Researchers at the University of Pittsburgh will be conducting a study in your area that could include you or people you know. The Cold Stored Platelet Early Intervention in Traumatic Brain Injury Study, or simply CRISP-TBI, will look at whether giving early cold stored platelets to people who have a traumatic brain injury will help stop it from getting worse. People who have traumatic brain injuries normally get platelets that are room temperature as part of their care. However, information suggests that cold platelets versus the normal room temperature ones may work better at slowing or stopping brain injuries from getting worse. Researchers think that giving the cold platelets sooner might also help. For the study, some people with brain injuries that are in the emergency room at Upmc hospitals will be randomly picked to get cold stored platelets. The other people will get normal care, which is usually room temperature platelets. Researchers will look at both groups of people and see if one group did better than the other. They will also do some blood tests and collect information from both groups of people as part of the study. Researchers believe the risks of getting cold stored platelets are the same as getting room temperature platelets, but there may be other risks that are not yet known. Normally, researchers must ask a person for their consent before they can be in a study. Because brain injuries must be treated right away, there may not be time to get consent. Giving consent for medical research usually means reading information, talking with doctors and nurses, and having time to think about whether to join. A person with a brain injury is often not able to do these things. Sometimes researchers can talk to the patient's family to ask for consent. However, in the emergency of a brain injury, the family is often not around or can't be found before platelets must be given. This study could not be done without special permission to include people before getting consent. Once the person is better and is able to consent, or their family comes to the hospital, the researchers will ask for consent to continue with the study. For questions or to learn more about this study, just click on the link below or visit www.lightsnetwork.org/CRISP-TBI.